Ladies and gentlemen, listeners, lovers, and friends, welcome back to the Prod. I'm excited today to host a guest that I've known for probably 15 plus years. I knew him as a soccer player back in the Warren JFK days. Now he is a doctor. He's got a lot of information, and we're going to pick his brain about how you can raise a incredibly healthy child. That's a lot of pressure.
It's a lot of pressure.
But you're going to be great at it.
Thanks, Dad.
You're welcome. Before we get to that, we've got to shout out and thank our advertising sponsors. They are the Station Square Restaurant, Salvatore's Italian Grill, Modern Methods Brewery, Green Life Holdings, now known as Prosperity Partners, and Brokers Realty. You can check out theprodcast.net, scroll down to our sponsors section of the website, click on that, any one of those fine sponsors, and be directed to their website to find out more about them, their locations, and what they offer. That's a mouthful to get that out.
You did it.
Woo, tough stuff. All right. I'm not going to say without further ado, because I say that with all the other episodes. I get tired of listening to myself talk. So I'm going to let you talk. I'm going to make this introduction. Mr. Michael Perisa was a standout athlete at Warren JFK. He was a soccer star, a track star. Did you play basketball too?
I think for one season, yeah.
Okay. Wasn't maybe a basketball star, but he was a star in the. And he went away to college and got all grown up. Now he is a doctor of pediatric medicine. He is a pediatrician with Zest Pediatrics, and we're going to talk about all kind of great stuff today. Welcome to the show, sir. I appreciate you being here.
Thanks for having me. Yeah, great to come down. Great to see you again.
It's great to see you. I don't know when the last time we saw each other was. It may have been your last soccer game, or maybe I ran into you at school at some point.
Maybe, yeah, it's been a while.
What year did you graduate?
2009.
2009.
Yeah.
Wow. See, that probably makes you feel a little older too.
Old, yeah, I'm old now. Yeah.
I was talking to my son last night, and I said, "Yeah, I got to get into work, a little bit earlier. I got to set up and do some editing." And he, "Well, what's going on?" And I said, "Well, I'm having a show tomorrow, and typically I try to do the show and then catch up on all my other work too, the juggling act." And he goes, "Oh, who you having on?" And I said, and he just came off of a victory last night. He's a sweeper. He plays U10 or U12, but he's a 10-year-old, and they bumped him up to forward because they were up 4-1 or something, and he ended up scoring his first goal of the season.
Heck yeah!
So he was all excited. So when he asked me last night who I was having on, I said, "Well, I got to tell you, this young man, this doctor, it's so weird to this guy is the best player I ever coached. True story. But you didn't go on to. Did you play collegiate soccer?
I didn't. No.
You ran track.
I ran track. Actually, went to University of Akron for a year. I tried to kick on their football team.
Okay.
Didn't work out.
Okay, gotcha.
My girlfriend at the time, now wife, was a year behind me in school. So she got into Case. I was like, there's no way I'm going to be able to afford this. I applied with their outstanding financial aid available to them. I was able to get in there, and then we both ran track for Case. Yeah.
Oh, that's cool.
Yeah, it was great.
So you're going to have some fast kids.
Hopefully, yeah. Or we'll send them back.
Send them back to the store. So when you left Akron and went to Case, did you know that you wanted to go into medicine? Was the plan always to be a doctor?
Yeah, it was for a long time. So it initially sparked by, I had an aunt who's a family medicine physician here in Warren. She was on a plane ride, it was 8th grade for me, and the plane crashed and she passed away.
Oh, geez.
And it was really sort of after that time that I wanted to pick up kind of where she left off and pick up the slack and kind of find a career in medicine to continue helping people and kind of honor her life through my work. And that kind of carried me through, college, medical school, kind of from there.
Man, that's awesome.
Yeah.
I mean, it's not awesome that your aunt unfortunately passed away, untimely. I'm sorry about that. But it's awesome that you're carrying on her legacy.
Yeah, she was a fantastic person. In the 40 or so years that she lived, she probably lived more than most people in their lifetime with all the stuff that she did. Mission trips, across the countries, taking her kids all over the place. She was a great lady. Yeah.
Steve Bornius, Coach Bornius. Steve passed away a couple years ago.
Oh, yeah.
Yeah, and he was the head coach when Mike was there. And I was an assistant along with Luigi Goinzueta and Phil Nadel. I still keep see those guys from time to time. Especially I see Phil a little bit more often. But he would always say we would always be talking man, that Michael Perisa, what a great player. Never stops, never stops, never stops. Go, 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 go. Played hurt, played bigger than your size. Not that you're not a small guy,
sure,
but
yeah,
played
back in the
bigger
day,
than
yeah.
your size. Yeah, you're a thin young guy. Did you play midfield? Were you a midfielder? Yeah. Ran all over the field, back and forth. But man, what a nice kid. Everyone would say, what a nice kid, what a nice kid. That sense of altruistic ideology, is that something that you always had? Is that where'd that come from? Because
Yeah.
I always remember you like being a helper.
Sure.
You've always been a helper.
Yeah, I think it really came from just my upbringing, my parents. The sacrifices they made to put me into Catholic schools and get me a good education, it continues to pay off to this day. But really, the values that they instilled in me. I remember working for my dad. He was a bricklayer. He's now retired, thank God. But just working with him for the summers really reminded me how much I wanted to go back to school because of how tough it was. And I knew the struggles that he went through to be able to provide for us, to be able to go to these good schools and get a good education. But working with him really helped me instill a good work ethic. And then my mom is just the sweetest person ever, hands down, not objectively, subjectively. It's not subjectively, objectively the nicest person around. But yeah, it was really just my upbringing and being around that and seeing, how they act and respond and how they wanted us to act. It just felt normal, right, to do those things that other people were seeing.
Well, it made sense, like, when I found out years later, obviously many years later, that you were a doctor.
Yeah.
And that you were going into pediatrics. So it makes a lot of sense. You always had a unique style.
Sure.
Bow ties.
Yep, got to.
And funny socks. So since we're on camera, for some of the viewers, what's your sock collection today? What are you wearing?
We're rocking some Bob Ross Happy Trees.
Oh, well, you should put your leg up and show everybody. Let's just see it. You still flexible? There you go.
I got some.
Bob Ross Happy Trees. Wow.
No mistakes, just happy accidents.
Well, so I wore these socks today for you. They're of my dog.
Love it.
Yes. Yeah, Gus Life. That's funny stuff. Now, do the kids, when they come and see you in the office, do they make comments on your socks? Is that like a conversation starter?
Yeah, it's a nice little icebreaker for the kids. But I'm not gonna lie, probably 95% of the reason is for me, because they're fun, right? Like that's part of my personality. The bow ties, the socks, it feels right for me. So I went with it.
You got the right personality for being a pediatrician. After you graduated and after some other jobs, you worked at St. Jude's.
I did, yeah.
I'm curious about that.
Yeah.
Seeing those commercials on TV, the kids and just to bring a little bit of a personal touch to it.
Sure.
Our son, when he got he got a couple of like cysts. What are they called? They put him in they don't do this anymore, but they'd like put him in a book and like ganglion cyst. Yep. He had one in his hand and he had one somewhere else. And then he had one somewhere else where like, does he have one like in his armpit? Like that's a weird spot. What are these things?
Yeah.
So we took him to the doctors and he said, well, since he's had a couple of them, let's run some blood tests and just kind of see. And came back and he had what was, I guess, called smudge cells. And, the doctor called me here, actually, his pediatrician, great guy, Dr. Becerra. And he said, man, I don't know. You got to bring him in because this blood test does not look right.
Yeah.
It could be a false positive. It could be a lot of different things, but I'm going to send you to Akron's Children's. And or maybe he sent us to university. I can't remember. There was somewhere where it was like pediatric oncology.
Sure.
You hear that word, all of a sudden you're like, holy shit, like he was less than a year old.
Mm-hmm.
And we went up to, I forget the hospital. It might have been the Cleveland Clinic. We went to Cleveland, my wife and I, the whole time. I mean, for 4 days before we went on this appointment, your guts are twisted.
Yeah.
Because the possibility was like childhood leukemia. And it was like, holy shit, man. And we fought so hard. My wife was like 4 months bed rest. We fought so hard for her to deliver and
Sure.
all this other stuff. It was like, man, we got him here, and now this is happening. So we go up there, and thank God it was a mistake.
Sure.
Like the slide, the blood cell, whatever happened. But we witnessed so many kids, no hair. I mean, just thinking about it, like I get choked up. We left there crying, tears of joy.
Yeah.
but felt so guilty because the kids who were there for treatment and whatever, they're living with this disease. And I know you went to when I think of St. Jude's, that's what I think of. Every time I see those commercials now on TV, it's like I got to break out the credit card and donate, because you feel like so terrible and so grateful that it's not you or it's not your child, but then so guilty that it isn't.
Yeah.
And it's a weird feeling. What's that like? What's it like working at St. Jude's and working directly with those kids?
Yeah. So I think the biggest part for me is to still remember, right, that they're still kids, right? They're still going through the same things that any other kid their age would be doing. And it really, seeing them in an environment where knowing that how sick they are, but seeing how much joy they can be getting out of just simple things, right? They have the therapy dog come around and see the kids, like they all light up. And it just seeing the smile on their faces, it really puts it in perspective for you when you're struggling with your stuff and thinking, something menial or that's silly and you shouldn't be worrying about it. And they're just seeing these kids who are going through so much and how well they're handling it, whether or not, they comprehend fully what's going on, and just their families that are supporting them too. It was incredible. A happier place, I think, than some people might expect, just because a lot of them, especially with the leukemias, the kids do pretty well with treatment. So even though it's a pretty terrible disease, like a lot of them are doing really well. But yeah, it was a great experience. I don't have, so kind of looping back to how I ended up at St. Jude and kind of where I'm at now, I got really interested in pediatric oncology from a younger age. Kind of after I decided I wanted to go into medicine, I went down to a children's camp at Cincinnati Children's Hospital. My aunt was a social worker there. And it was a cancer camp for kids. So they're out, doing normal camper things, running around, having fun in the summertime. I get there, I'm like, is this the right camp? Like, these kids have cancer, right? Like, they have their ports on, they should be getting chemo, but they're out there running around and having fun. I'm like, this is incredible, right? Like, just being a part of their care and their treatment, knowing how sick they can be and just experiencing the joy that they were experiencing, piqued my interest in oncology. And that kind of carried me through medical school, the grueling hours of, residency. And that was the plan for me. Going through residency was to go into pediatric hematology oncology. We just had our son shortly after I decided to go into fellowship. I sat down with my wife and we're like, is this still something we want? Are we okay with being away from family for a while and knowing that, the hours are pretty long? I'm not going to see them that much. We decided it was okay at the time. So that's when I got into St. Jude and did my fellowship down there. I was only there for 3 months, but it was an incredible 3 months. Shortly after that, we had a death in the family, some major health issues that came up. We're sitting down in Memphis, Tennessee with our 1-year-old at the time, 13 hours away from family, and we just decided that we needed to be back closer to family, right? Because they're so important to both of us. My wife, from Warren as well. We went to high school together. Being closer to family, letting our son experience his cousins, his grandparents, it was more important than anything else for us at the time.
Family's number one.
Absolutely.
I mean, God, family, health.
Broadcast.
Whoa. Man, that's a lot of pressure. Yeah. Not for me, it isn't. I was having a conversation again with my son the other day, and we were talking about someone had gotten robbed, and he had said, and it was over like whatever it was. Sure. Like the guy got shot over he wasn't going to give somebody whatever the person was asking for. Give me your money. All right. And my son's in jiu-jitsu and martial arts, and he plays soccer like we were talking about. Mm-hmm. And he's, he wants to be tough. And he goes, well, what would you do, Dad? If someone came, and I said, man, I'd give them whatever they asked for, Now, if they were trying to steal the car and you and your mom were in the car, or you and the dog, or, sure, just the dog, or you, or what, that'd be a little bit different. Yeah. I'd try to negotiate that. I need my family. I wouldn't try to negotiate. I'm getting my family out of this vehicle. And you can have my car. You can have my money, because there's no, you can replace those things, but you can't replace, obviously, family. And what's I say interesting. I always use the same words. After you do so many shows, then you go back and as you're editing, you're like, oh my God, you say the same thing all the time. What's important is that, I believe, is that we raise a new society, the new future, the new group of kids that are going to grow up and take care of us old people, so that they have a sense of purpose,
Yep.
and they have a passion for everyone, not just themselves, because we're such a me society now, especially with social media sometimes.
Yep.
Like, look what I did. And, everyone's guilty of it. I'm guilty of it.
Sure.
Okay. I love I love taking pictures of my dog. I just posted some this morning. It's like, there's my dog. I love my dog. Okay. Love my kid. He's playing soccer. You got a call?
No, I'm good.
Oh, okay. Michael had warned us ahead of time he might get a call, so he's got to answer it.
Yes,
Yeah, it's
always
important.
on call 24/7.
Yeah. What's that like, man?
Yeah, so the model of pediatrics, just to give listeners a kind of sense for some understanding of it. So I initially started off in a general pediatrics office, so major hospital system, like anything you would experience, even similar to private practice. Given that they're insurance-based repayments, most companies, again, to make money, need to make sure that you're seeing enough patient volume to be getting repayment enough to cover your expenses and to cover your salary. The healthcare system, and I'm sure a lot of your listeners can attest to the fact that it's broken. It is so broken for patients, for doctors. I'm sure the companies themselves seem to be doing okay. They're putting up new buildings and things, but it's not focused on what really matters is patient care, patient satisfaction. How can we make this better for families and patients? So I kind of got fed up with it after even just 18 short months. And, in a busy respiratory season when kids are in daycare and school, coughing all over each other, they get sick a lot. We got busy seeing 25, 35 patients a day sometimes. And it's not sustainable for anybody. I felt like I wasn't able to fully take care of patients' needs in the way that I wanted to from the start. And I was telling you a little bit before, my breaking point really, in the midst of this respiratory season, seeing 35 patients a day, I had a 12-year-old for their yearly checkup. And the fact that a 12-year-old is going to talk to me for 20 minutes and get all of their problems out that they need to, and me go through all my check boxes so that I get repayment from insurance company is just idiotic to think about. But we were going through their depression screener that they didn't fill out like they were supposed to at the beginning of the visit. I go over and look at them with them, and they're off the charts depressed. They're talking about suicide, that they're suicidal. And I'm sitting there, I'm like, I need to sit here and unpack this with you, like for everybody's sake. But it's not fair to you. It's not fair to my 3 or 4 other patients that are already waiting for me to be seen just because of how income-based repayment currently is. So shortly after that, I stepped away, and the person who hired me for my initial job had broken away from traditional insurance-based repayment healthcare as well, and started this Zest Pediatrics. So Zest Pediatrics is the first pediatric direct primary care network in the country. There are plenty of other kind of one-offs that have been doing it, maybe for the last 3 to 5 years it seemed to pop up. And what direct primary care is, it's membership-based care. It's concierge style, we say. So our families pay a monthly membership fee, almost like Netflix subscription, if you will, for all of their health care that can be delivered within the office. So there's no copays. There's no extra payments for in-office testing, your streps, your RSVs, your flus, things like that. And with that membership, they get unlimited access directly to their doctor. So our patients call. We had plenty of families call the number listed for our office. Myself or my partner answer. It's just the doctors. It's just the patients. It's really how it should be. There's no insurance telling me, you need to make sure you ask this question or not. Obviously, it's important. We'll ask it, but we're not restricted by the red tape of insurance-based repayment. We can deliver care how we best see fit. That's 24/7 access directly to your doctor. Texting with your doctor. That's right. Texting with your doctor, right? Sending me pictures of rashes. Is this something I need to worry about? Most of the time, it's going to be no, right? Because kids get sick. Viruses cause lots of rashes. We do home visits. Up to 6 months, typically, we say, especially for newborns. If anybody with a newborn thinking about bringing your newborn into a busy pediatric office with other sick kids, it can be terrifying.
Sure.
Even for me with our second one, I'm like, I know how sick kids can get. And if they get sick early on, it's so scary. So we do home visits. It's really, we can be more nimble and creative with our care because we're not restricted by insurance, red tape. And it's been the most fun I've ever had. Ever with work, and it's been so rewarding, and our families love it. They love texting us the most because everybody's texting now.
Lenten time or anytime, Station Square Seafood is delivered daily and always prepared fresh every time. And now to go with your salmon, swordfish, or any favorite dish, Station Square's small batch signature seasonings: lemon pepper, Cajun, or charcoal steak rub.
Need great food fast? Visit mysalvatores.com and order anything on our menu for quick pickup. All of your favorites ready when you are. Specials available on mysalvators.com. Order today.
With that buzz of select Brazilian Dolce coffee beans, that brew Ipanema's seductively sweet beach coffee, they mingle a flawless measure of their crisp Darlene lager. Somehow, somewhere in a secret lab with modern methods, they blend the perfectly balanced, light, uplifting, gold medal winning brew known as the Percolator. Available at Modern Methods Tap Room or the new Darlene Lounge on Courthouse Square in downtown Warren.
Well, it seems like this type of healthcare makes the most sense, but unfortunately, because of the insurance companies and probably because of lobbyists and other bureaucratic, kind of bullshit, we're not preventatively treating patients. We're only treating the problems.
Yep.
And there's a country in Asia. I wish I had a better citation on this. It's the same thing. Mm-hmm. They pay their doctor monthly, except when they're sick. And when they're sick, they don't pay the doctor until the doctor or their physician or the medical staff treats the problem and gets them back on the right course. We talk about the future, like try to raise our kids and raise the future generations to like have this idea about caring for everybody. Sure. I hope that this is something that the future generations can also see, that medicine should be more individualized. Your genetic makeup is obviously different than mine, is different than my neighbor's. Sure. And so, we might all have all the same symptoms. We might all have the same disease or the same disorder, but the treatment may be different because you're allergic to this, or you're, whatever it is.
To the sun. That's what it is.
You're allergic to the sun. Yeah. You're still
still pretty fair skinned.
You're still a very pale man. Like, for those.
But yeah, in that individualized care, it can't happen. And oftentimes too, like when you're trying to get in for a sick visit, like most families aren't seeing the same doctor. Systems prioritize getting families in when they need to be seen, but it might not be with their provider, or it might not even be that day. And enough families are getting frustrated, and we're seeing some more kind of pickup because, they'll hear about us, kind of what we're doing. It might not seem, quite in what they're looking for right now, but then they go back to their standard office and have a bad experience, and they know that there's a different way. And that's where we're seeing a lot of kind of influx come. But yeah, we definitely feel like it's going to be the way of the future because enough families are getting frustrated with what is the norm. There's a better way, we feel like. And we're actually working on a Medicaid pilot too, to show Medicaid how much money we can likely save them if we can keep their patients healthier, right? Keeping them out of the urgent cares, keeping them out of the emergency rooms for unnecessary things. If we can be more preventative with our care, we're hoping to show them, and then maybe even insurance companies, the value in this, that if they, are able to subscribe, we can save them money in the long run. Again, reducing those ED visits, those urgent care visits. So that's a long-term goal. Again, if it doesn't work out in a year and you see me homeless, just throw me some food side of the road.
How does that work for someone who does have traditional insurance? Does traditional insurance cover any of this?
Nope, they won't. It pairs really nicely with a high deductible HSA plan for families. So you still need insurance, right? Vaccines are expensive. Unfortunately,
HSA is a health savings account?
Health savings account, yep.
Okay.
Yep.
So these are folks that, because this is like, some people aren't aware of it, right?
Yeah.
You're taking part of your income and you're putting away in a health savings account
Yep.
for when you get sick, and then you use that for the...
Yep, and they're tax deferred, I think, most of the time.
Yeah.
But yeah, you still need insurance. Vaccines are expensive. We want to use your insurance to pay for that. Emergency room visits, hospitalizations, unfortunately, still happen regardless of how good your care can be because kids are unpredictable.
Yeah.
Right? Surprise.
Kid's going to jump off the deck, break his arm.
Got to test our limits, right?
Yep.
So you still need it for
Not
that.
texting the doctor when that happens,
No,
maybe.
straight, yeah. You still need insurance for those, but we usually we tell our families who join, it pairs really nicely with a high deductible, HSA plan. High deductible, if you switch from your normal insurance plan to a higher deductible plan, the cost savings come when we can avoid those urgent care visits, when we can avoid those after-hour visits, because they have direct access to us 24/7, right? Family calls us in the middle of the night, their kid has croup symptoms, right? That barky cough, that
Oh yeah,
scary,
yeah,
it's
my kid gets
terrifying.
that.
We have steroids right in the office. We can meet them at their house if they need to. Again, spare them that emergency room visit. If they need to go, right, we're not going to stop them from going. But if we can be more preventative and they have better access to us, the cost savings are going to show up when we can avoid those extra visits that don't need to happen.
How many patients do you have?
So a traditional office, each pediatrician would have about 3,000 patients per doctor.
Wow.
Can be very tough. Some of the older docs are a little bit better at, having that personalized connection with families. When a direct primary care practice is full across the country, it's maybe anywhere from 250 to 300. We're planning on 300 patients per doctor.
Oh, wow.
So our visits can be much less rushed, right? Instead of that standard 15, 20-minute time block, typically our blocks are an hour. If we don't need the full hour, fine. But I want that 6-month-old to get down on the floor and show me some of their developmental skills, right? Like we have time to really unpack that, spend as much time as families have with all their questions. What was so frustrating to me through training and even, at my previous job, family comes in with a list of eight or nine things, right? That's how it goes. They see you once a year. We're going through a list and like, okay, pick the top 2 or 3 that you want to talk about. That's all the time I have for you. And that's just a terrible message to families, right? Like, I want to spend as much time with them as they need because I only see them once a year at that point. But yeah, it takes all the stress, I feel like, off of families because they know they can reach us when they need us. If we need to spend an hour and a half sitting down with that 12-year-old to unpack that suicidality and kind of what's going on with them, like that's what I want to be able to do for them. And that's what this model allows.
See, I really like this idea. I think this should be like across the board. And I don't know if it's, a membership setting or however it works.
Sure.
But there's no way something as important as our health or a family member's health and having a conversation with a doctor is a 10-minute office visit a lot of times, right? It's something that needs to be given enough care and understanding rather than you feel like you're on the conveyor belt, it's not industrialized medicine. Like it's not the same model as how we manufacture a car on the line and the next guy does this and does that. How are the results that you've seen how long have you been doing Zest?
So we officially opened January 1st in both Solon and Westlake. And our sister practice, Greater Cleveland Pediatrics, opened 3 years ago or so. And just to kind of step back and talk about how Zest was founded, Zest was founded by 3 main people. So Dr. Drew Hertz, who was initially with UH, who hired me for my first job, Keely Mistovich, who started her own direct primary care practice, Greater Cleveland Pediatrics, about 3 years ago, and then her husband, Justin Mitchevich, who is a pediatric orthopedic surgeon at UH. So we're really modeling ourselves after what Greater Cleveland Pediatrics has done, Keely Mistovich in their office. But the 3 of them really kind of got together and thought through what Zest Pediatrics should look like. And we opened officially in January, and then our Westlake office, like I said, and then we just opened in Pittsburgh a couple weeks ago too. So that'll be it for 2023. As far as 2024, we're open to look for places where people want to buy into this model and want a different, better way to practice medicine.
Well, what's your range? Like, how far do you travel, like for a patient? 50 miles?
Yeah. So we say there isn't really a range. If it makes sense for families, I have families that drive from where I previously was out in Chardon. It's about a 45-minute drive for them to the office. But again, a lot of times because we have enhanced telehealth capabilities, texting, video chats if we need be, they don't need to come to the office. They don't have to. I've run out there a few times to see them, but as far as a limit go, an hour and a half maybe, if it makes sense for families, and we don't have a closer office, we'll still see them.
Yeah, that's pretty interesting. I'm very excited about the potential of the future, specifically for medicine and technology. Last year, we purchased a 3D 360 virtual camera.
Yeah.
And it wasn't a very good one. I mean, it was okay. It took decent photos, decent video, but it wasn't clear enough to see. It's not like each camera on this. There's 4 cameras are in 4K. But it's 4K stitched in a global sense rather than on a flat screen, right? So that 4K is broken up over a much greater surface area, if you will. But I started thinking about this because people were talking about, with COVID and, we had virtual meetings and we had, this, that, and the other. And my dad lives in Florida, so we do FaceTime with his grandson, my son. But I started thinking about how this virtual thing potentially could affect medicine and surgery. Now if you want to get a colonoscopy or you want to get imaging of your colon, some people can swallow a capsule, and it's a camera, and it takes however many pictures, and then the doctor can look at it, and it's almost not as good, but almost as good as a colonoscopy. I started to think about this. What if a doctor could put on a virtual reality headset, which probably will get smaller in time, and the patient can then ingest or be injected with a very small, high precision, high pixelated camera and see inside someone's body. There was a movie called Inner Space years ago with, are you familiar with that?
I've seen it one long time ago.
Okay, yeah. I was like, wow, because it's came out probably before you were born. Dennis Quaid is in it. But anyways, he's supposed to go inside a rabbit. He ends up in a human, and he's, shuttling around in this
Magic School Bus style.
Yeah, spacecraft kind of deal. Yeah, Magic School Bus style. But that's the possibility of these virtual reality cameras, and because it's not always about treating the problem once you have it. It's about diagnosing the problem and diagnosing it early enough so that it doesn't become a bigger problem later on.
Sure.
Have you seen any limitations, or what are the limitations in telehealth, and what are the freeing things in telehealth that you don't have with a brick and mortar kind of coming to see the doctor in person?
Yeah. So kind of to answer both parts of that question there. So we still have the brick and mortar office. So if our patients need to come see us, they can. But I think with the telehealth capabilities and not being restricted by insurance companies, we're able to use some of these new technologies, right? So I tell a lot of my families and some of the other doctors as well too, we have digital otoscopes, so the ear looker, right? Kids get ear pain all the time.
Yeah.
I show my families, and if they feel comfortable using that thing, send me a picture of what their ear looks like when they have pain, right? I can look at a picture on a screen on a phone. If it looks infected, great. Not great, but I can treat it, and you don't have to come into the office. So it's really partnering with families that feel comfortable using the new technologies that are out there. There's some stethoscopes that they have that'll record sounds, right? So if a kid's got a cough, the family could throw on a stethoscope, record what it sounds like on their back. I know, it's nuts.
Now,
it's
how
crazy.
do they get these? How do they get the devices? They have to buy
them
them
all separately. Yeah. I think the otoscope that I use, or the ear looker with families, is about $30 on Amazon.
Get out of
pairs
here.
Right with their phone. But it's just in a normal kind of insurance-based practice, the doctors don't get paid necessarily to spend extra time to prevent those things, right? They just don't have the time for it. Now we have the time. We talk with our families. We teach them how to use some of these technologies if they feel comfortable, if it makes sense. Let's do it, right? That's what I tell my families. If it makes sense for you, I want to provide that level of care for you.
That's awesome.
Yeah.
Want to be debt-free faster, save money in taxes and insurance, and retire with more wealth? Call Zach Byler at Green Life Holdings today for full-service financial advisory. 330-219-5225.
Top Shelf Bar, 450 wines on hand, and your choice of local craft beers, including Modern Methods Brewery Double IPA, now available at the Station Square Restaurant.
If you're looking to buy new or sell your current home or commercial property in Northeast Ohio or Northwestern Pennsylvania, look no further than Brokers Realty at brokerssold.com.
The future seems pretty bright.
We hope so. And this is, maybe one of the solutions to our healthcare problem. It's definitely not the whole fix by any means. And I think a lot of times we'll get questions, with the fact that you're only seeing 300 patients per doctor, you're taking away from already our physician shortage. Sure, we hear that. Our kind of response to that is, okay, you think about all the physician burnout that's going on, right? People leaving medicine early because they just can't take it anymore. If we're able to keep providers on longer, keep them happier, practicing longer, that should definitely help. And then more people seeing how happy we can be and how productive we can be and how much of a work-life balance we can have with this style of medicine. More people want to go into primary care setting, hopefully into pediatrics, again, because they can have that value back to their life instead of being, just bombarded with patients every day, and not living in the most happiest style that they can. So
it probably is a great time saver as well. You go into a doctor's office, everybody has experienced this. I talked to my friend like, I waited for an hour to see this guy, and then he saw me for 3 minutes, and that was it. Like,
Yeah.
okay, cool. This would be because there's one thing we're never gonna get back. It's the time that we waste.
Yeah.
I'm sorry. I don't know if the prodders can hear that. Can you hear that drill?
I can, yeah.
Yeah, it's kind of distracting. My apologies. They're
okay.
obviously doing some work on the building next door in the back. And listeners, we apologize if you're hearing construction sounds. The time saver, the energy saver, right? If you had to drive 15 or 20 minutes to the doctor's office, both to and from, you're spending money on gas and your wear and tear in your car, which is not much, obviously.
Sure.
But the time issue, and then not being in the same room as 40 other sick people, that's got to be, there's definitely a value there to that.
Yeah.
Now, here's my question, and if you can't say it, obviously it's okay, because I'm sure with like individualized medicine, maybe the pricing is individualized as well. What's a range of like a monthly cost?
Yeah, so
for Zest?
Depends on the age of the patient. If you think about it, the younger kids obviously are being seen more often, so they're a little bit more expensive. It comes out to about $1 a day.
What?
Yeah.
Wow. Now, what kind of Starbucks are you talking about?
Because that's a good question. Yeah, it depends. It's not the venti triple shot extra things. 180 a month is what we start at for newborns up to 2 years old, and it gets kind of cheaper with that. There's already discounts built in for subsequent kids. Think about getting 3 or 4 kids together. It can get pretty expensive. We kind of factor in for that, and then we typically set a family max, just again depending on the size of the family. But it comes out about $1 a day or so.
Your basic cable bill.
Right, and if you're pairing it with that high deductible plan, you're using your HSA account. We always say have families check with their insurance company to make sure that it's qualified, that they can use their HSA account. All of our families who have tried have been able to, and we're working to try and get legislature changed to make it, on the books, like, yes, this is covered, because it makes sense. It's medical care. But again, thinking about the cost savings, avoiding those urgent care visits, avoiding the co-pays with office visits when you're coming in. Of my families who have joined, I suspect broken even, if not saved them money up till now. And again, it's only been since January. So.
Well, and they're probably getting better care too.
They are. And speaking of the waiting room too, like usually it's one person in the office at a time.
Wow.
We don't have a waiting room because there's no receptionist. It's the doctor and the patient. So you walk into our office in Solon. It's an educational space, right? I got to play mat because you got to for the kids. Right?
Sure, right.
My kids did a splatter painting thing too. That's my pride and joy of the office. I gave them some acrylic paint and said, hey, go have fun. They threw it around. It looks awesome. And then my mom's an art history teacher, so I spent an hour looking how to do one of those museum tags and got like the font. That's how much time I have on my hands now. But
nice.
It looks good. But there's no waiting room. It's usually one family in the office at a time with a doctor. They're, as soon as they arrive, we'll meet them at the door, bring them in. We have snacks, we have coffee, we have drinks for the families because we can spend more time with them. So if the kids are hungry or thirsty, or even it's just a nice, icebreaker for the kids, they walk in and say, "Oh my God, you have Teddy Grahams?" And one of my patients asked me last week. They walked in, they said, "Is this a hotel or a doctor's office?" I said, "It's up to you, man. It can be whatever you want it to be." But it's different. It's a different vibe, and it's just different from what people know medicine to be. And I think as soon as people walk in, like, wow, this is not what I was expecting. This is so different than what I expected.
Are you guys getting resistance from the insurance companies?
I don't know that we've worked with or talked with some of them. I think we're in their minds, too small right now to be an issue. But what we really want is, as we're getting some of this data, hopefully as this Medicaid pilot starts out, we can have more information for them to show them the cost-saving benefits. And then we want to partner with them, right? Because our goal would hopefully be to have, insurance companies, cover these costs. Again, if we show them, if we can save them money, it's a better level of care, we believe. At the end of the day, like, money's important. And I feel like that's probably one of their top priorities. If we can show them that, like, hopefully they'll want to end up partnering with us again if we give them the good results that we expect we can.
Well, certainly from a patient standpoint, my wife covers our insurance policy. Mm-hmm. She works for the county. I'm a small business owner. So my plan when I was covering myself was close to $500 a month. Yeah. That's a pretty substantial amount of money.
Yeah.
Your patients probably, if their employer covers their health care and their family health care and they have a family plan, boy, it'd be nice not to have to pay that $180 a month or two, whatever it is.
Yeah.
But you're probably getting, I'm just hypothesizing here, you're probably getting a better care quality from your doctor because your doctor is not burnt out. Your doctor has time to spend with their own family.
Right.
Your doctor has time to kind of live their own life, get the proper amount of sleep, eat right, and not have to eat in between visits while there's, 40 people in the waiting room, and then you get out of the waiting room and you go to those other little individualized waiting rooms. There's 8 of those things or 10 of those things. It's like, I think it would be difficult to have that type of. I have found that after, of course, there's some downside to it too, but after the pandemic and the lockdowns and how our business has changed, I may not be making as much money.
Sure.
Because I don't have as many clients or as many people to staff for those clients. But man, I'm a lot happier, and healthier because I've got a little bit more time and a little bit more flexibility.
Sure.
Like I won't miss my son's soccer game.
Yeah.
I won't, like that kind of stuff. But if you're in the office all the time as a doctor, then you're probably missing those things. And that affects your mental and emotional well-being,
Sure.
which probably affects your
Patient care.
Yeah.
Definitely can. And I think, since we have more time to spend with families, they're getting better level of care because we know them better too. Right? You think about, your kids starting off early on. As they grow up, adolescents don't want to talk to anybody. And that's fine. If we have a better relationship with them, when problems come up, we're not such a foreign figure to them. It's not the first time they've seen us before to talk about these problems. We want to be integrated as part of their family, essentially, is how we want to feel, because we have that extra time to spend with them. I really want to get to know all of my families, their specific needs, so that when they call me, it's not, oh my gosh, like, let me pull up your chart. I don't know anything about you. Like, I've got it all already locked down because I don't have that many patients. I have more bandwidth to spend and think about, okay, this specific thing's going on with this patient. I know more of their history already.
Are there other, I'm imagining yes, are there other programs like this across the country? I mean, you guys can't be the only one, right?
Yeah, so we're the only network so far, pediatric network.
Okay.
Some of the family medicine practices, I think there's a few networks out west. This style of medicine's been a little slower to adopt in Northeast Ohio, I think probably in part because of the bigger health systems there. But there's no other pediatric network across the country. There's plenty of one-offs. There's one, I think in Boardman there was one that just opened up. There's a few up in Cleveland. There's one down in Bath. But the goal of with the network is it lowers the threshold for people like myself to be able to come into this style of care. I would not have been able to do this by myself at this time point because I needed some steady income to pay for my family. I wouldn't have been able to have the time to sit through and think about like everything I need to do to start up a new business. So what our partners, Drew, Keeley, and Justin have done is lower that threshold. They give us the tools that we need to open up these offices and kind of help us get going as we pick up our patient volume to be able to, actually make some money off of it.
Wow.
Yeah.
Yeah, this is really cutting edge kind of. It's this newfangled stuff that we've got to start to
Back
think
in my
about.
day, we didn't have anything like this.
Right. Well, it's so funny. Oftentimes when we talk to people, they'll use this as an argument. Well, I've always done it that way, or it's always been done that way. Okay, well, that doesn't make it. I don't want to say it doesn't make it correct.
Yeah.
Maybe it's not the most efficient way to do things, or maybe it's not the best way to do things, or maybe there's a way to do it better or healthier. So this is very interesting. Do you because you've done a lot of research in your career, you were I saw that you published some stuff in some medical journals and periodicals and whatnot, and because you were involved in oncology at a young age, or at a young inspired at a young age when you're just a student. Talk to me a little bit about Ewing sarcoma.
Yeah.
Because I was reading your resume a little bit,
yeah.
and I was like, oh, I've never heard of this before. And then after I started reading about it, I was like, oh, this is kind of a slightly terrifying thing, although it seems that if it's caught early enough, it can be treated very successfully.
Yeah, and it depends a lot too on the location of it, how quickly people find it. It's one of the most common solid tumors that we'll see oftentimes in kids. Osteosarcoma, I think, being number one. Ewing's right up there, number two. The issue that oftentimes will happen is it's not caught until it's a little bit later on, later stage, so it's already kind of metastasized and spread. Depending on how early they catch it, treatments can tend to be good, but it's so individualized to specific receptors now, again, with how much medicine has advanced, all of the genetic testing they do on the tumors to see, is it going to be susceptible to X, Y, or Z type of treatment. It's come a long way for sure, but it still has many years to come as far as getting, the best kind of individualized treatment for it. But treatment has definitely improved that we've seen.
These are tumors that are found in like bone and soft
Bones.
tissue.
Yep. Solid tumors, bone, soft tissue. Mm-hmm.
Yeah. And like if you catch this thing in your teens, it's typically not a great outcome. But
It definitely depends. Yeah, what we've seen as far as risk factors for worse prognostic factors. Older age, depending on location of the tumor, right? Like a central tumor, we say, so like anything on your central skeleton, pelvis, which you can't really get to surgically. Thinking about being able to remove the tumor surgically, tend to have worse outcomes. And again, thinking about myself when I was a teenager, if I had a little bump or bruise or a little swelling somewhere, I probably wouldn't say anything to anybody. That's sometimes what we're seeing with these kids is they don't come in until a little bit later on. It's been there for some time, and by that time, some of the tumors already spread to other locations.
Well, that's what I was going to ask you, Ray. So early diagnostics is the key with this thing.
Mm-hmm.
Are there any new early diagnostic techniques? And if there isn't, or if there is, what's a parent to look for? Like what's a child to look for?
Sure.
They're not going to, like you said, you
Yeah.
get a bump and bruise, you don't really say anything.
Yeah,
Are there
yeah.
other symptoms?
Yeah, so sometimes there'll be these B symptoms we talk about. So fever, weight loss, night sweats, things like that can be common with a couple different types of cancers. I would say pain that's not improving with kind of standard therapy. So, your Tylenol, your ibuprofen, or pain that's kind of persisted or worsening without a good cause for it, right? If you're playing soccer or playing other sport, you get hit in the leg, you expect there to be some pain. I'm thinking about a kid who isn't super active but has pretty good swelling and some pain in an area where they didn't have an injury. Those would be things to tip me off that, hey, maybe we should probably get this looked at or at least talk to somebody about it.
Wow. Interesting stuff. You have children of your own now?
I do. We have a 4-year-old Nolan, who's 4 going on 30, I think. A 2-year-old Kennedy, and it's hilarious. So Nolan was like 90th percentile for growth, like from the start. Just a big, thick dude. He's nice and thin now because he runs around all the time, doesn't stop. Kennedy is like 20th percentile. She came out, she was so tiny. And like comparing the two, it's so hard not to compare, between kids, between your friends' kids. She looks so small, but she's normal, right? She's following her own growth. And I think that's something for families to remember is like your kid is doing their own thing. It's so hard not to compare them to other people on Instagram that you see or anywhere else on the internet. But we have the 4-year-old and the 2-year-old, and then we just found out we're pregnant with our 3rd. So
Boom.
Yep.
Congratulations.
Thank you.
I know
March,
I've already said that earlier, but
March, our
for the
lives will
record.
change for the better.
For sure.
Kids are so fun, though.
How has having kids, changed your approach to pediatrics, or has it changed it? I gotta assume it has.
No, it definitely has. I think going through training, kind of learning the pathology as far as like, the disease processes and what that looks like in kids, you do your best to be as empathetic as you can with families, but nobody can truly understand what is going on with that specific family, how they're dealing with it. Having kids, I think, helps some get a better understanding of it, right? Because as your kid's sick and going through it, you're on the other side of that, right? You're taking them into the doctor's office to be seen for their illnesses, for their concerns. It makes me, more humble with myself, making sure I'm not missing anything, but also more understanding and caring, I feel like, for those families, because sitting on the other side of it, sometimes you really fully understand at least in part, what they're going through.
Since COVID, I hate always talking about COVID, but it's so prevalent. A lot more talk about vaccines and things of that nature. Of course, recently, I believe it was the Cleveland Clinic had a study that came out, and they were saying that, if you had the vaccine, you might be more likely to get COVID. Now, I was vaccinated a couple times. I didn't get the 3rd booster or any of the other boosters.
Sure.
I got COVID twice. It sucked both times. The first time was worse. My son got it. 2 days later, 3 days later, he was totally fine. Yeah. What do you say, or what is because I'm not in the field, what's the general ideas that folks have that are in pediatrics or that are in medicine now about vaccinations? Like, there's, of course, Robert Kennedy is now running for president for the Democratic side. We'll see how that goes. And he's he's been labeled an anti-vaxxer, and they talk about some of these things. Like, what's your feeling on vaccines, and what's your when a patient or a parent comes to you with those concerns,
Sure.
like, hey, I don't want my kid to get vaccinated because I'm worried about myocarditis or whatever those issues that the COVID vaccines had.
Sure.
How do you respond to that, and what's kind of your general guidelines or recommendations for them?
Yeah, I think we've had more time now to spend with families to unpack that, because first step is whenever I am greeted with a family who has vaccine concerns, like, they're allowed to feel and think however they want, right? Like, I do not know where they're coming from. Until I sit down with them and try and unpack where they're coming from, I feel like until we have that conversation, neither of us are going to be able to sort of fully understand where they're coming from or how to approach it moving forward. So I think once we initially kind of unpack those concerns, the fact that we have more time to be able to dig into some literature and provide information for them, like, at the end of the day, I'm not going to change their mind if they're completely against it, and that's fine. They're allowed to feel that way. All of us practice by the American Academy of Pediatric guidelines that vaccines save lives. We absolutely know that. And with some of the more kind of vaccine-resistant times we've seen now, some of these diseases that were gone or very minimal before are starting to come back. Polio, measles, mumps. It's who knows what the future is going to look like if this trend continues. But I'll greet any of our families, and I think we all follow a similar approach that even if you don't want to follow the exact guideline of this is the schedule that you have to follow, you're worried about the number of actual vaccines per visit and overwhelming the body, fine. We're happy to meet you where you're at. At the end of the day, what we want to do is protect kids and keep them healthy and safe. And if that means us taking a little bit more time to do it because the family's more comfortable, fine.
Did you see any incidents of myocarditis and kids that were getting the vaccine for COVID?
Not of the patients that I had. And again, that was a little bit in between when I left my previous job with UH September 21, and then kind of when I started with Zest. We don't have a whole lot of patients compared to what we were doing before. Our number of patients who had vaccines much smaller than what it would have been if I was still in practice. But of the ones who had it, I don't think any of mine had any real complications with it. But again, small sample size. So
sure.
Yeah.
How do you feel about I'm not trying to be political on these vaccines at all.
Bring it.
I'm curious because I'm genuinely curious.
Yeah.
It seems like folks who were obviously, and this makes the most sense, right? If you didn't smoke, you weren't overweight.
Sure.
If you ate a relatively healthy diet, you got enough vitamin D, and you didn't have any deficiencies in vitamins or minerals, your body seemed to, and you didn't have any pre-existing conditions that were, you weren't on immunosuppressants, or you seemed like folks recovered relatively well. Like
Sure.
I recovered relatively well. My son went through it in no time. My wife was sick for a couple of days, but everyone is relatively healthy. Do you feel like, or do you guys in your own practice, from preventative purposes, is there enough of a promotion of these healthy practices, get enough vitamin D, what zinc, C,
Sure.
all those things, versus we're just Band-Aid medicine, we're going to treat it with a vaccine, and the vaccine is not going to prevent you from getting it. It may reduce the symptoms, but you're still going to get it, or you're potentially still going to get it.
Sure.
A lot of people I know were vaccinated,
Yeah.
myself included, my wife included, and we all got COVID.
Yep.
What's your thoughts on preventative medicine, and what's your recommendations, like,
Yeah.
especially for kids?
Sure.
Obviously.
I think a lot of it comes from what was your expected outcome from getting that vaccine? Was it that it was going to, prevent the disease itself, or was it that it was going to be potentially milder, or that you might not pass on as severe of a form to somebody else? Mm-hmm. So we really look at it from that second point. Same thing with flu. Flu vaccine, plenty of people end up refusing it. And I think a lot of them will say to us too, when I have some people who don't want flu, is I've never been as sick as when I got the flu vaccine that year, or I got the flu after getting the flu vaccine. The vaccine itself is supposed to reduce the severity of illness, not necessarily prevent it. And what we recommend for families is you might not need the vaccine yourself if you're healthy, right? But if you think about you getting infected and then spreading it to either a young child or an older grandparent or parent yourself, that's where we see the benefits of vaccine, is really giving that kind of herd immunity, is where we're trying to protect other people by you getting vaccinated. So I think a lot of it comes, and a lot of resistance comes from what were you expecting the outcome to be from getting that vaccine or that treatment, as opposed to what actually is it meant for. So the CDC just updated their kind of slogan for this year's flu vaccine. I think it's, go from wild to mild. That's a thought, is you want to go from wild influenza down to more of a mild form.
Yeah, a little bit, probably a bit smarter of an approach, so people have expectations that aren't unrealistic. Curious on this one. As you're seeing newborns and young families, and a lot of these families may or may not be investing the time and energy into the amount of research. If you're not a doctor, you're not a dietitian, then you might not have been exposed to it. What are the protocols, or what are some of the recommendations you're giving for nutrition for families? And for example, like when my son started drinking milk, it was like DHA, high omega-3, good brain fat, good fat for the brain. Like, what's your 1, 2, 3 step for new parents who may or may not be listening, or grandparents that can pass this on for people for their kids?
Yeah, I say first of all, be cautious with what you find on the internet.
That
should be said for
good
most
point.
things.
Yeah,
there's so much good and bad information out there, and it's sometimes even tough for professionals to know if it's a good recommendation or not a good recommendation. They might have a good website, but they might be coming from a place that doesn't meet their best interest. So I say just be cautious with what you find on the internet, and use your healthcare providers to help you tease through that, right? Like, you are not in this alone. We tell all of our families that, we are here to support you. I tell everyone, if you're sitting at home worrying about something, you're on Google, you found out that your son has ovarian cancer. First of all, boys don't have ovaries, so try and forget that part of it. But you can easily spiral down and find yourself in a situation where the internet is just scares the crap out of you. So use us as a filter, I like to say. As far as recommendations for food and diet goes, every kid is so specific to their own needs and what they, what they're bringing in and what their needs are for that day. I think most of us are on the approach that there is no cookie cutter, every single kid is going to fit into this box, right? Kids don't work that way. They don't come with a manual. They don't follow it. That's why we have a job. But it's really sitting down and unpacking, how much milk are they taking in a day? Usually we recommend families switch over from breastfeeding or formula to whole milk around 1 year of life. That's a pretty easy one to go to. And then typically keeping it less than 24 or so ounces a day after that. Sometimes if they're getting too much more milk than that, they're not absorbing other nutrients that they should from their foods, and they can have issues with iron absorption. Milk, that's a pretty easy one for milk. Fruits and vegetables, I'm sure you can attest to this. It can be a struggle sometimes to get vegetables, especially into your kids. I usually say smoothies are a great way to sneak in some healthier stuff that they're not tasting, and kind of mask it with some peanut butter or some other stuff too. But we see a lot of concern from families with food introduction. And again, how should I do it? There's this baby-led weaning out there. Should I give them the mushed up stuff with a spoon, right? It can be terrifying. And no matter what you do, it's the wrong thing based on 40 or 50% of the internet, right? Because everybody's so polarized and divided now. We have time to sit there and unpack that with them. That's what I want, and that's what we want to be able to provide, is more individualized care, to sit down and answer those questions and tell them that they're doing an okay job raising their child, even if 40% of the internet says they're not.
You gotta have a pretty challenging. Your job's got to be pretty challenging.
It can be at times. It can be, but it's so rewarding and so fun that, again, knowing what I know now after going through, I don't have any regrets as far as the path that I've taken to get here. I did it all with the best intentions, at least at the time, from what I understood. And I'm happy and proud of everything that I've done. But it's given me such a perspective and a sense of kind of gratitude for what I'm able to do now and how I'm able to provide the care that I can now, that I wouldn't do it any other way now.
See, I think that's great that you mentioned the word gratitude. I don't know if we're grateful enough for the things that we have. If you go on social media, you can see a lot of people maybe posting things that aren't true to their life.
Sure.
And then other times you're on there and people are posting all kind of crazy, it's like a parakeet, right? Or a parrot. People are just parroting things that they've heard from somewhere else.
Sure.
And that positive mental attitude and how you approach things, I think, is a big factor in how we live our lives, right? And what the trajectory of our future is. If we're constantly out there being negative and spreading stuff that we don't, I'm mad at the world for whatever reason. The other day, this is a little off the subject. The other day, I'm scrolling through and there's a post, and it's from a person, and this person is saying, they're kind of knocking, the world today is this and it's that, and we got to get our country back. We got to take our country back. And I'm thinking to myself, take it back from what? I mean, what? And they're saying, this is like we're on the brink of becoming a third world country. And I saw like this post had many, many likes and many, many comments.
Sure.
And I'm thinking to myself, we're not anywhere close. The United States is nowhere close to being a third world country. By definition, a third world country is a non-industrialized nation that doesn't have superior tech.
Sure.
And they don't have great medical practices. And a lot of their folks, it's like, no, man, that's not reality.
Yeah.
How important do you feel it is for a parent or a patient to recover from because I'm sure you've seen, like we mentioned, Ewing sarcoma and some other things, like not talking about like the cold or cough or,
Sure.
The flu. How important is it for recovery for that patient and that person or that parent to have a positive attitude?
Yeah, it can make a load of difference, and maybe not necessarily. Well, there is some studies that show that outcomes can be improved with kind of a positive kind of sense and vibe, but just their experience with it, and then going back and thinking through, like, yes, they went through their treatment. They were sick at the time, but if they had kind of a positive spin on and finding some of the positives in what was going on, their perception of what happened was just so much different. And that can be true across any sense. So really having that positive attitude, can help them improve quicker, feel better quicker. But then their memory and the recollection of it can be polar opposites.
What do you recommend? I mean, do you ever run across a parent or, obviously a patient? The kids are a little bit different.
Sure.
But a parent that's just like negative on the treatment, like it's the glass is always half empty, the sky is always falling.
Sure.
How do you transverse that, and how do you change that?
Sure.
Or do you change it?
Yeah, we do our best to. And a lot of that comes back to the same sort of thoughts with the vaccine talk, right? Where is it coming from? And until we really get to the root of what's happening, we can chase around all day and try and dance around, why are you this way? But until we really sit down and unpack what were your experiences before that led you to feel this way, and where is that coming from, before we can really talk through, because I can talk all around vaccine concerns, but if I'm not addressing their root issue with it, like, it's a waste of time for everybody. I don't build good rapport with them. But if we have time to unpack where they're coming from, they make that connection with us. Maybe at the end of the day, they decide that, I'm still a whack. That's fine. If that's what they decide, that's fine. Then they're not a good fit for us, and that's okay. But I think really, as we're able to give them the time of day and fully sit down and listen and understand them and give them a voice to be heard, I've seen pretty good results with some families that have been a little hesitant on some things here and there.
How important do you feel physical activity is for kids?
So important.
I mean, obviously you're a former athlete,
Yep.
and like, talk about that. Like,
Yeah.
You've got people who are hesitant to put their kids into sports, or maybe the kid's just not athletic and they're into different things.
Sure.
And, I always come from an environment of, it's a great social thing for kids, especially when they're younger. Yeah, they might not be a great athlete, or they might not live up to the potential that their parent sees or thought that they would,
Sure.
or even their own potential, if you will, their own expectations. How important is that physical activity in that, especially in sports?
Yeah.
Like team sports or individualized?
So kind of answering in two parts here. I probably gained some of my most valuable sort of attributes, or honed in some of my most valuable attributes from sports. Teaching you dedication,
You had some
teaching
good
you hard
coaches,
work.
maybe.
Not at Kennedy. But it really teaches you teamwork. Like, you need teamwork skills for everything in life.
Sure.
It really helps you, and the kids don't understand that they're gaining these skills at the time, but then when they're put in an environment after they've been in kind of a team sport, they might, hone back to that. Oh my gosh, like, I was able to function well with these other people who were different than me when I was playing. Now I'm in a job where there's plenty of other people doing different things, and I need to be able to work well with them. It's great for that. It teaches, and it does a great job of fostering some of those skills for patients and families. And as far as the benefits of exercise, numerous studies have shown mental health, physical health, like 60 minutes a day is what we preach to our families and our kids, at least 60 minutes of some sort of active time. I don't care what it is, right? You can be dancing to YouTube videos. You can be walking around outside with your dog. I just want 60 minutes of active time. In the winter, it can be tough, especially in Northeast Ohio when it gets dark at 4:30 or 5 o'clock. That's when we say find some indoor activities potentially at that time. And then balancing your exercise with screen time too. Screen time is, especially with COVID, it's just exploded, and we've seen such a worsening of mental health issues, maybe not necessarily just because of screen time. We typically recommend families less than 2 hours a day, and if it's going to be something, try and make it maybe a little bit educational if they can.
Yeah, that's tough, man. 2 hours a day.
Not excluding school stuff, right? School, like, they have to be on it if they're at school on tablets, but
yeah. Saturday at my house, my dude's on that screen. First thing he wakes up, like, it's hard to wake him up Monday through Friday. He's tough to get up. Oh, I'm so tired. Saturday and Sunday, dude's up like 6:30, 7, jumps out of bed.
Coffee's already,
yeah. He's got his coffee and he's online with his buddies, 3 or 4 of his buddies, and it's not one screen.
Sure.
It's multiple screens, right? So he's got the PS5 and he's playing whatever he's playing, and he's talking to his dudes on his iPad.
Yeah.
And we get concerned because we're like, man, there's a lot of, I'm glad that socially he's interacting and having a great time, and they're laughing, and he's loud, they're loud, it gets to be a little bit annoying at times. I'm like, hey man, keep it down over there. But how do you curtail that? How do I rationalize with my kid?
Sure.
What's a data set that I can tell him, hey man, if you spend less time on this, your outcome in this area is going to be better. You got any good advice for that?
So I think try not to be too strict and stringent. Like, yes,
Oh, boy.
we're given our 2 hours a day as recommendations. Teenagers, I think 95, if not all, 100% of the teenagers that I've interacted with are well above that, right? You think about all the time on their phone or, video games or whatever it is. I try and meet them a little bit where they're at, right? Like, give me 30 minutes here and there. Give me an hour back. If you can give me some extra time that we're taking back from screen time doing something else, maybe it's doing exercise, maybe it's doing art, maybe it's doing something else that just makes you and allows you to sort of unpack your day and really get in touch with what's going on with yourself. I've succeeded in my mind. Again, we're not going to be able to get every single kid down to the recommendations, but that's not the cookie cutter thing that we're looking for. I want to individualize their care, and each kid's so different too that if I can get 30 minutes back from some of those teenagers, I feel like I've won for the day.
How much does psychology come into your job?
Yeah, we're seeing a lot more of it now too, especially with COVID. Anxiety, depression, off the charts. I don't know if
How old are most of these kids?
Yeah, it depends. I had an 8-9-year-old with some pretty severe anxiety in the office recently. Teenagers, plenty of them were struggling with some concerns and issues too. The more time you have to sit and unpack with families, I think the deeper we dig, the more we're finding there's issues. And sometimes these kids are hesitant to bring it up, right? Like, I remember going to the doctor's office. I didn't want to say anything, right? If I said something, then that means they have to do extra things, and I'm worried more that something else is going to happen. And getting a better relationship with patients, you're probably noticing some things, right? If I know a person's demeanor because I've seen them since the time they were born, every single week or month or whatever it is, up until the point where they're going to yearly or every 6-month visits, and I notice something's off, I can sit there and talk with them. Parents might bring up some concerns, but if you have a relationship with the kids, you're able to sit and spend time unpacking that. We can talk through some mindfulness activities. We can talk through some deep breathing activities that in a traditional setting I just wouldn't have time for. I'd want to do it, but I just couldn't because of the constraints of it. So yeah, I sat and we did some deep breathing, some mindfulness and belly breathing techniques with one of my patients recently. And it just felt so good because that's how care should be delivered. I want to give you everything that I possibly can for this. I want to follow up with a text message later on at night to see how you're doing. I want to send you links to YouTube of videos and things that you can try. And it's just really how it should be. Yeah.
Just like we get inoculated from vaccines, I feel like we get stress inoculated if we're presented with stress. How much is good stress? How much is bad stress? And especially because I know the type of athlete that you were.
Sure.
It's very rare that you get 2 MVPs sitting across each other from JFK. You were that type of player. I was that type of player. I always kind of looked up to those guys like, hey, shake it off. You got banged up on the field, or you got tackled hard, or you took a ball to the face, or maybe it wasn't soccer, maybe it was football, whatever it was. I watched you play with a lot of injuries and kind of tough it out. How important is that today, where I feel in others, like, is there a little bit of like I don't want to say coddling, because there is a great, I'm a very physical person.
Sure.
I hug and kiss my kid every day. He knows that I love him. There's not a shortage of that in our house.
Yeah.
But it's also like, hey man, you got to tough it out a little bit. You can't be, where do you stand with that? And how do you pass that on to parents to kind of get kids to the point where they are stress inoculated, so that when they get out in the world and stress presents to them, that they're not going to fold, or it's not going to affect their physical health? Because as we know, the higher stress levels you have, the higher cortisol, the less your immune system is, the more you get sick, and that kind of thing.
Sure. Yeah, I think healthy stress is kind of what we're looking for in stressing. Dad joke for the day. At this point. So I want them to have situations where they can experience some stress, because stress definitely can provide some better outcomes, but in a space where they feel safe and they have tools to work on through those stressors. So sports, again, are a phenomenal way to kind of, play around with some of this, right? The stress of a big game coming up. That teaches plenty of kids and patients to work through those situations. What I don't want is the continued and worsening stress of a kid thinking about school, right? Like school avoidance issues, thinking about a test coming up, something like that. There's plenty of unhealthy ways that stress can be experienced. And as far as parenting styles go, like, again, the internet is so divided and polarizing that no matter how you're approaching your child, it's the wrong way to a lot of people. But kids are pretty adaptable in certain situations, and they can learn and do a good job almost regardless sort of how parents are doing with them. But it's important to be a good role model for them, even if our upbringing was a little bit different. Kids can still come out just fine, even if you're doing a different parenting style than maybe you were used to or that I was used to. But I think just showing them that love that you talked about is probably the most important thing, that you care for them and giving them a safe space to unpack those stressful situations when they do come up.
You brought up, school avoidance. And sometimes that's due to academics,
sure.
Right? We were up till 8:30 last night. My son's like, my friends stay up till 10:30. I'm like, well, that's them.
Yeah.
Okay, you're in bed at 9 o'clock. You go to bed at 9:30. We're studying, right? And he's like, he gets very frustrated sometimes. Biology. He's just getting into sciences. So that you have avoidance in that issue. Do kids? Do parents bring, or do some of your patients bring these issues to you, or it's like a bullying type of situation? Because I'm a firm believer that, and I'll just, from my own standpoint, like, I didn't know anything but a very loving environment.
Sure.
And even, so when I got to, and even through, I had buddies in elementary school, and we would bust each other's balls kind of thing and tease each other and that kind of thing. I don't even know if a lot of times kids are aware that some kids are not aware that this guy is, quote unquote, making fun of me, but that's something that kids do. Like, I see it now that my kid's 10 and
sure.
I hear how I never knew anything but love when I was brought up. Yeah. So when I got to middle school and I had some behaviors from other kids that were, I don't think there was malice involved. I don't think it was mean-spirited.
Sure.
They were just teasing like kids do. But because I wasn't inoculated from it, I didn't have an older brother or an older sister. I didn't have older cousins that, kind of roughed me up or that kind of stuff. I mean, grew up around a lot of females. Sure. I grew up, my dad and my grandfather and my uncles were all very caring. There wasn't any roughness, especially for boys.
Sure.
Although it's true for girls too. If you're not inoculated to that, I feel like your reaction sometimes might be an overreaction where a kid's just kind of teasing you, but you take it as, well, that person doesn't like you. And then you start to have these feelings of anxiety.
Sure.
Does that get presented to you in your practice?
Yeah, it can come up from time to time. And again, it's such an individualized, scenario with each kid. I think the more we can get kids out to socialize early on, they're going to be able to pick up on some of these things and kind of, again, get exposed to some of those, playful kind of back and forth banters with other kids. I think I've seen more issues in a situation where kids maybe were homeschooled or kind of off by themselves in a very nurturing, loving environment with all the best intentions. And then when they get in more of a social setting, again, kids can be mean, right? Like they don't understand, how other kids maybe necessarily react or what they mean by that. So I think in more situations I've seen that where they don't have that previous exposure, that it can come up. And then, maybe the parents don't know the concern, but they just see their kid as not wanting to go to school, right? Like they're not going to tell their parents anything. Being able to spend more time and unpack, like sit with the kid and say like, hey, like what's going on? Why are you avoiding school? You say you have belly pain. I'm 90% sure your belly pain is not because your belly actually hurts because of a medical problem with your belly. There's so much belly pain that we see in kids, especially with school avoidance, just psychosocial wise, like things going on. They don't want to talk about it. It manifests with stomach pain. That's
wild, man. I just had Dr. Andre Camelli on, and we were talking about this, this kind of the brain gut connection, right? And also kind of talking about I'd never heard of this before, neuro-emotional technique. Are you familiar with this at all?
Not that one, no.
Yeah, it's I'm not either, but it's apparently maybe a psychological thing that it's maybe something you haven't dealt with, and making that connection between stress and anxiety from your brain that can affect the rest of your your physical body.
Yeah.
People who get concussions typically have higher incidence of digestive issues, which I wasn't aware of. Did you ever have a concussion playing soccer?
Not diagnosed by a medical professional. Thinking back now, yeah, absolutely.
Yeah.
I remember one game I took a shot, missed where I was supposed to be hitting with my head. Was pretty loopy after that for a while. Still played the rest of the game, which wasn't great at the time because
you were a savage out there. You really were.
I still have some brain cells. Yeah, it's great.
I have a very few. I think. When did you stop playing? Do you still play?
I play a little bit. We have a Monday night rec league that I'll sometimes go to with a couple of my other Kennedy buddies. It's fun. It reminds me of how good I used to be and how good I'm not now.
You have to adapt your game.
Yeah, that's true.
You have to play the smarter game now. You can't just rely on your physicality. I
can't just run around and hit everything.
Yeah. That's funny, man. What do you do when people come to you and they have concerns about those type of sports like football or hockey or soccer? Where your potential for those three sports, including boxing as the fourth, obviously have the highest incidence of concussions.
Sure.
And you got a parent that comes to you and says, "Hey, my kid wants to play football. I don't want him to play or soccer." Or
sure.
How do you approach that? Being a guy who played, and obviously still plays.
I think counseling them that there are measures we can take to hopefully help avoid certain situations. Again, making sure they have the right equipment, that it's fitting properly, that it's up to date on things. So there are some things that we can do preventatively to try and limit their risk of head injuries or concussions. It just happens sometimes, and I think sitting there and unpacking with them, okay, these are the things we look out for after a concussion. Like we want to make sure that we're doing what we can to not put them back in a situation that they're going to get another head injury anytime soon. But just really sitting through talking about preventative things that we can try. I don't want to limit any of my patients if they have a desire to do something, and it's relatively safe, right? Like I don't want to put kids in situations that aren't safe, but there's plenty of benefits that can be had from those team sports, like we were talking about already. That I don't want to prevent the families from that, but just setting them up in a situation that they can do it as safely as possible.
Well, like with CTE or traumatic brain injury, if your son and potentially maybe your second son, do you know the
TBD? No.
Yeah. If they come to you and say, "Hey, Dad, hey, Mom, I want to play football, or I want to be a boxer, or I want to," what's your thoughts on something like that?
Yeah, I think with boxing specifically, just knowing the amount of head trauma that comes with that, I would probably try and steer away from that, or maybe give a small taste of it in the safest setting. But soccer, football, again, just setting them up as safe as we can with it. Again, I didn't play tag. I was a kicker for football, so I kind of played, but not really. It's probably the best position, so that's what I'm going to steer him towards.
Yeah.
But no, if he wants to do it, and I'm sure my wife's probably the same way too. We'll let him. If we start to get head injuries, then we'll kind of talk about pulling back and restricting that some. But I want him to be able to find his purpose, his meaning, his understanding, his love, his desires. Not just because I'm forcing them on him, because I did those things, right? Like, I hope he loves track. I hope he loves soccer.
Right.
We're slowly kind of introducing it to him that I think that's going to set in. But if he wants to dance, if he wants to do gymnastics, like, fine, like, great. Like, I'm happy for him. If you're happy, I'm happy.
Being a parent's challenging.
Yeah.
I gotta think that being a parent as a pediatrician is extra challenging, similar to how being a parent and a social worker. My wife works with high risk kids, and so she's hyper aware
Sure.
of all the dangers that are out there. She's worked on task force with human trafficking.
Mm-hmm.
And, I mean, it's the stuff that she sees in her life. I always call this as like the fantasy world. I live in the fantasy world, and she lives like in the real world.
Sure.
I don't want to live in the real world. I want to keep my Peter Pan syndrome as long as I can, and think the world's. But I got to think, like, knowing all the diseases and things of that nature presents a little bit of an extra challenge. Do you think so? Or
It can.
Yeah.
It can. I think what it does for me, really, at the bottom of all of it is have a greater appreciation for their health, for their development, that they're doing fine, that they're doing well. Again, seeing so many situations where that's not the outcome, that every single day is such a joy. And the fact that they're healthy for the day, great. I try not to take as much for granted, which can be so easy in today's world.
how about multivitamins, supplements? Do you like those?
Yeah, it really depends
Flintstones?
on what the kid's eating.
Yeah.
Again, if a kid has a pretty terrible diet, like, yes, I'll recommend it. Technically speaking, if kids are eating them a pretty well-balanced diet, they should be getting all the nutrients, maybe with the exception of vitamin D in Northeast Ohio, since, Mr. Sun isn't around too much. I'd like to recommend it for most families if kids are a little bit of a picky eater. It's not going to harm anything. Do they need it? Probably not if they're eating a well-balanced diet. But again, I'm going to give you as political answers as I can on this podcast.
Are you guys doing any type of like diagnostic blood testing to see like, oh, this kid's deficient in D or B or
Yep.
magnesium? Or...
Yeah, and again, depending on the age, depending on the patient's symptoms, usually we'll screen for lead, we'll screen for hemoglobin or iron deficiency at certain time points. I suspect most kids in Northeast Ohio are going to be close to, if not actually deficient in vitamin D, but we'll sometimes add that on to kids who are coming in for their like teenager labs. And as far as the practices go, right, like we have the full capability to practice at the highest level of our license. So we have like stitches we can do in the office, which going to traditional office probably doesn't have, right? Like we have more time to sit and do some of these extra creative things. We can do blood draws in the office. Because we have more time, we can do some of these extra things that usually you don't see in standard practices.
Oh, that's cool. So you do it right in the office. So you're not sending them out to like LabCorp or a local hospital
Not
to do
necessarily.
stuff.
Yeah. Yep. Each one's a little bit different as far as what the provider's comfortable with doing. To be honest though, right, like the phlebotomists who do these tests all the time are going to be a little bit better at drawing it probably than I am, since I'm not doing it quite as often. But if it makes sense, if I need to go to a patient's house to see them, if they have developmental issues or they're wheelchair bound or whatever it might be, if it makes more sense for me to do it, like let's just do it so they don't have to go to somewhere else.
How are you staying healthy yourself?
I do my best to exercise. With 2 kids coming on 3, it sometimes is tough. Waking up early some mornings, I think it just doesn't happen because the 6:30 rolls around. You're like, I could probably sleep for an extra 15 minutes, and my kid is not screaming yet. So it's finding the times when you can, setting your realistic expectations of what I want. I'm not going to be able to go on a 90-minute bike ride most days. Like if I want to get out there and do something, make it do a 10-minute row exercise or something, just to get my heart up a little bit. Walk around. It's tough though.
Are you taking supplements, vitamin D, or like what do you?
Yeah, I'll do a multivitamin. I do some fish oil. That's pretty much it.
Yeah.
Lots of love from the family.
Most important. That's the most important ingredient.
Yeah.
Love from the family.
Easy to swallow for sure.
Yeah. Well, I really appreciate you coming on today.
Yeah.
I want you to, after I clear my throat, I want you to give our prodders a place where they can find you.
Yeah.
Maybe the website or some other things if they're interested in Zest Pediatrics or they're interested in reaching out and touching you. No,
Yeah.
that's not really, but reaching out and talking to you.
Yeah, absolutely.
Or,
Zestpeds.com, zestpeds.com is probably the best kind of jump off point. From there, if families are interested, they can select what office they want. They can drop us an inquiry. What that will do will get kicked to our inbox. One of the doctors will call them back. The doctors will call them back, right? If they find our offices on Google Maps or anywhere else on the internet and they call that number, one of the physicians are going to answer the phone. So don't be surprised if you guys are interested and you call us that, myself, Dr. Hertz, or Dr. Lynch-Luby on our west side answers the phone, because that's what we're about. It's patient-centered, more direct care, no more red tape, better taking care of you and your family.
Man, that's wild.
It's been great.
Yeah, like I have a relationship with my, not my primary care physician, but my specialized, where he's like, just text me or call me up. I might not get back to you for several hours because he works crazy hours. But that is a very unique and a very rare experience. Yeah. Right? And I'm grateful for that. This is something that they can have all the time.
All the time. New parents, it is so good for that. Plenty of families text me like, oh my gosh, I'm so sorry about asking this. Like, that's what I'm here for. I'm here with any questions or concerns you have. There's so many issues and concerns that come up with new patients or, a new baby, right? They're terrifying. They're cute, but they can do some interesting things that can scare the crap out of people. That's what I'm here for, to help them walk through that and make them realize that their baby is probably doing just fine.
Awesome. Yeah. Hey, I appreciate you coming on the show today.
Thanks for having me.
Dr. Michael Perisa, Zest Pediatrics. Prodders, until the next time, stay cool, stay kind, and be electrified. You can find more shows at theprodcast.net. Don't forget to like, listen, and subscribe, and check out zestpeds.com. And you can maybe be part of the wave of the future of individualized medicine.
Yep. See my picture with the bow tie too. Go with the cool song.
Handsome man. Thanks, Mike.
Thank you.
All right, brother.